Hello, this is the University of Ghana subgrantee team. Our project is titled Utilizing Artificial Intelligence to Promote Sexual and Reproductive Health Outcomes for Adolescents with Disabilities in Ghana. My name is Abigail Edubia-Mills of the Department of Social Work at the University of Ghana.
I am Michael Koligu from Department of Computer Science, University of Ghana.
And this is Sylvia Estejan from the Department of Sociology. For our project, we sought out to fill the gap in terms of access to sexual and reproductive health information by developing AI solutions to make sexual and reproductive health information easily accessible to people with disabilities.
So the AI solution we propose to help this problem solved was chatbot.
We had to approach it by first gathering data, then after the data, move on to train a model to have that done. So the model had to be built in such a way that we have both an input, which is audio, and then an input, which is text, as well as an output, which is also text and then also audio. Now, during the testing with stakeholders, right, some of the issues that came up was the internet, which meant that some would had to fall on the offline version. Another lesson we learned had to do with those that were hearing impaired. For them, some of them presented an idea that it would be better for us to include video of the signing of the various texts that we had in the responses that they were getting. Yes, it's implementable, but that specific area, currently in artificial intelligence, is a green area. It's one of the things we can look at in the long term. With regards to inclusion, it started right from even the gathering of the data. The specific prompts that we came up with to fetch this data set were put together in such a way that they were quite inclusive. And also after, when we gathered all these close to 7,000 question and answer pairs, we had Ghana Health Service coming in to validate the data.
This project creates awareness that in Sub-Saharan Africa, we ought to recognize the need for local content in utilizing AI solutions. During the stakeholder forum, where we brought together parents, representatives from special schools, Ghana Health Service, Ghana Education Service, and the adolescents themselves, one parent clearly explained how thrilled and relieved she was to have such an innovation coming up. Having assurance that this chatbot designed to be culturally sensitive, she is assured that her daughter would only have access to relevant information.
We had to widen the scope of the project with the hope that we will get more information to inform the chatbot that we wanted to develop. However, we realized that even widening the scope of the project did not allow us to have enough information that could fill the chatbot, and so we had to rely on large language models. Now, this also came with its own problem, where we had to now move funds around so that we will be able to achieve our goals. But we want to thank the funders for allowing us to move budget lines around so that our goals will be achieved.
With next steps following our project, we plan to apply for more grants so that we can scale up the deployment of this chatbot. In doing so, we are going to continue collaborating closely with the Ghana Health Service and the Ghana Education Service to make this a reality.
I believe in coming up with projects or conducting research that will develop interventions to touch lives. And this HASH project actually provided such an avenue.
As a social scientist, I have benefited tremendously from being a part of the HASH network by learning about artificial intelligence in a much deeper way than I ordinarily would have prior to this project?
I have learned so much about sexual and reproductive health from these great colleagues of mine. They have so much in-depth knowledge in this area that if it wasn't for this project, I would not have benefited.
Yeah, that must say.
Yeah, you are a dog.
Thank
Thank you.